I mentioned that there's also a health action partnership in Walker County, and here today to talk to us is Dr. Karl Hamner. Dr. Hamner is the Assistant Dean of Scholarly Affairs for the Capstone College of Nursing and the School of Social Work at the University of Alabama. He serves on the board of directors for the Holt Community Partnership, and he's vice chair of the Health Partnership of Walker County. He's a member of the University of Alabama Council for Community-Based Partnerships and the University of Alabama Technology Research Advisory Committee. He's also on the Alabama Veterans Network, or AlaVetNet. He's on a bunch of other things as well. He's written and directed the development of a number of very successful grant proposals centered around health. He has his PhD in sociology from the University of California, Los Angeles. Please welcome Dr. Karl Hamner.
Well, again, good morning, everybody. I'm happy to be here today, mostly to represent Walker County. And I hope that you agree with me that imitation is the best form of flattery because we stole your stuff. We have plagiarized as hard as we can, which I highly recommend in what we're doing, but not in your term papers, please. So we've been working on a health coalition and developing a health coalition in Walker County since I arrived on Paul Kennedy's desk at the Walker Area Community Foundation sometime in 2007. But in the past year, we've seen more growth and more impact as the Health Action Partnership of Walker County, through the generous support of our supporting organizations, the Walker Area Community Foundation, the Community Foundation of Greater Birmingham, and just a great bunch of people. And it's really, my job is more of cheerleading and brokering expertise and taxi service, because I drive up from Tuscaloosa to Walker County on a regular basis. Well, Paul, I think I've logged over 10,000 miles now for you, so just remember you owe me tires. He's got rich donors, they'll give me some tires, I'm hoping at one point. But so we've done a lot of exciting work. Our goal is to make Walker County a healthier place to live, work, and play. It's a great community, very undeserving of some of the harsher stereotypes. I just actually was talking to my physician, the one who's trying to keep me walking with my bad knees, but who's made the old joke about Walker County being a great place to hire a hitman again. So it's got a bad reputation, as Drew pointed out. Someone has to be 66, that's us. But so when we saw the bold goals, top 10, we're like, really? Wow, that's a lot, we need help. So that's one of the reasons I'm excited to be here, is that we need help. And we want to partner with you to do that. But we're also getting a lot done up in our county. And so I'm here to share some of that with you. There we go. So we have the same model that you do. I'm going to drop all my stuff. But so we're working in these three areas of priority goals of healthy people, healthy food choices, and livable communities. And so these have worked really well for us. They've brought our community together in a way that we have not seen before, and really helped us engage our community. So under Healthy People, we've developed a digital database of physical activity opportunities. We're mapping out our county's activity resources. We are organizing free fitness classes, and we've got over 200 participants, and people are coming to cycle, to aerobics, and all sorts of different activities that are going on. We're working to promote a tobacco cessation plan for the county. Under Healthy Food Choices, we're creating community-level meetings to look at current points of access. We're promoting healthy eating, and Paul's going to share briefly with us an exciting development in that in just a minute, because they want me to tell you about a meeting that I wasn't at yesterday. And then we're building relationships with local organizations to really promote more healthy eating, more food, and access to healthy food. So it's an exciting set of things that we're doing. And in livable communities, again, we're building a digital database of where we can engage in outdoor activities and relaxation. We're creating a master plan for greenways and blueways. So this is something that's really, it's a beautiful community up there. And we need more places up there to walk safely, to drive, to cycle safely. And we're really making progress in that, through that master plan. And we want to expand our recreational amenities at Walker County Lakes, so we're beginning to start that process. So the lake that's traditionally been limited to fishing, and so through a lot of negotiations, since it's owned by the state, we're expanding it, and we're now in the process of planning out a whole set of expanded healthy walkways and bikeways and so forth. So that's very exciting. We're going to pilot a walk to school day coming soon. So the school district's a great partner of ours, one of our anchor organizations. And we're really leveraging our resources to the capacity of our partners. And so with the support that we've had from the Community Foundation, the Greater Birmingham Walker Area Community Foundation, we've been able to work closely with our partners at United Way, and Sarah and Katie, thank you so much for all the work that you all have done. And we were able to get some full-time effort on this through our former student worker turned our project manager and coordinator. So we were really emphasizing that, or utilizing that support in great ways. We've also been able to get art funding. So we will provide physical activity equipment to 10 Head Start sites, and expand the available equipment and training for the agribusiness program. So there really is a lot that's happening. And we've got to do a lot, because if we ever want to get to the top 10, that's a long run for us. So the partnerships, the resources you provide are great. So we're really happy to have been able to borrow from you. The only thing I wish we didn't borrow is your color scheme, because I'm red, green, colorblind. I think we stole your color scheme. I don't know. So our next steps are, we want to do more education combined with healthy options. Sorry, I don't have my slides printed, so I'm to promote a culture of health in Walker County. I mean, we have great resources. We've got a major hospital, we've got providers, we've got partners. We're still 66th. So we're in the top 20 in resources. We're in the bottom 3 in outcomes. So we've got to work on that culture of health. And that's something that we've been talking about for a long time, and now we're making inroads. We're excited about that. We need to look at our policy, our systems, and environmental changes to create access to healthy choices throughout the county. And we want to design and implement a scalable and sustainable model to work for that long-term change that you're all thinking about. I'm going to ask Paul Kennedy to come up and share one recent success, but as also, you know, this stuff is slow, and we want to share successes. I will share something really that's not related directly to Walker County, but this is a long haul for all of us. I mean, it's been years to get the kind of the change that we need to take place. I can just say that I'm very excited to report at the University of Alabama in Tuscaloosa, as of January 1st, we'll be smoke-free, which we never thought was going to happen. So, maybe we can drag Tuscaloosa along to be smoke-free like Jasper is. So, anyway, thank you everybody for your help, for your support. All of those that are working with us in Walker County, please raise your hands. Give them a hand, because that's where all the work is going on. And Paul, come up and tell us about what went on yesterday.
This is not planned, very impromptu, and it's strictly confidential. You can't take it out of the room. We had a meeting yesterday. We have Paul Leolio as a partner with Jim and Ix. Jim and Ix is a great community player in Walker County, and he is all about local food, food access. So he had this idea. There is an island behind his restaurant that's probably 50 yards long and maybe 15 yards wide. He said, we need to turn that into a demonstration farm. Behind that, in this parking lot, high traffic area, is Home Depot. So yesterday, Elise Peters, our local Health Action Partnership Coordinator, brought together the Walker County Center for Technology, the McDowell Farm School, Home Depot, Jim and Ix, the Community Foundation, and we're going to start a farm out there. A demonstration farm. We're excited about it. I'm going to leave you with one other little challenge. That Walker County Lake project that they mentioned, thanks to Gus shepherding us through the Community Foundation. Thank you, Chris Nani, for some help with the master plan. That is a 460-acre parcel with 163 acres of water that Walker Countyans didn't even know was there. And I'm going to tell you that if you come now, you can see it before. And if you come back in about 5 years, you're going to see a little Oak Mountain State Park out there.
So next is just the last note I'll leave you on is it's developments like that that have us really excited, and that it's through being able to model on a successful partnership that you have here that has enabled us to make such great progress. The last thing that I'll share is that in our December meeting, we had one of my faculty members, Dr. Deborah Wisnick from the School of Nursing, College of Nursing, who has been engaged in health promotion in communities with real serious challenges, in poor communities in Jamaica and Haiti. But it's a faith-based approach, and we've been trying to engage our faith communities in Walker County around health for a long time. And she has a model that she's actually implementing at her church in Warrior, and we're hoping to bring more broadly into Walker, because that's where all three of our priority areas can come together. And so we hope to really have an expanded impact on health with that partnership and that model that we'll be sharing. Hopefully next year we'll share some of that growth. But that's the kind of stuff that we can do, is share these ideas and broker these talent that is so much available in the room. So thank you very much.
Thank you, Karl and Paul. I think we'll be soon returning the compliment by imitating you guys, so looking forward to that.